to a new episode of We Need to Talk. Today's episode is about political influence on mental health. I just want to first start by saying I hate talking about politics, but I got outvoted by the guys.
No, good job, guys. Good job.
Lies.
They outvoted me. And now this is today's episode. So why are we talking about political influence on mental health? Because political issues, elections, consequences of elections, and the political issues and the political decisions all influence mental health. And not just when there is election year and you have to vote for a president or a prime minister, etc.
Or dictator.
It affects our everyday life. So political decisions like policy changes, laws being implemented, economic struggles, or even successes, wars, and other environmental impact, the list goes on and on. All of that affects our mental well-being on a personal and a societal level. So from a mental health professional standpoint, i.e. me, I try to look objectively at these topics, but I'm sure the guys will chime in once we get rolling about their opinions, my opinions, but looking at it from a black and white and then adding some gray area. So me adding the black and white me adding the gray area. Me adding the objective while they're adding a bit of subjective. I might add in a little bit of subjective, but I usually hate to do that because, like I said, I hate talking about politics. So from a Caribbean standpoint, first of all, even though we don't pay for healthcare in Barbados, our healthcare system still has some issues when it comes to mental health. So we only have one ward that you can go to in the hospital, and in my opinion, it's overworked staff, and they need some serious sensitivity training and increased training on how to handle patients on that ward, because a lot of the times they tend to not handle people like if they're human beings, because they're having a mental health issue at the present moment that they're on the ward. So, but I digress. I'm not going to get into that rant just yet. Mental health affects everyone, and even people like me who really don't like to talk about these topics much. So let's talk about it. So first we're going to talk about healthcare policies and how healthcare policies and politics shape mental health access. So healthcare policies determine how easy or hard it is for people to get the care that they need, including mental health services. They're different political approaches that create varying systems. So there's like a universal healthcare system like in UK, Canada, or Barbados, where the systems try to have free or low cost healthcare for everyone, funded by taxes. And mental health services are usually included in that, but there are often long wait times or limited resources that can be used for these issues. There are privatized healthcare systems like in the US, where healthcare is provided mostly through private insurance or direct payment, so out of pocket. And access to this mental health depends on if your insurance covers it or your ability to pay out of pocket, and sometimes the plans don't cover it, so it leaves people without support. So let's talk about that for a second. As I was just about to rant about the healthcare system here, how we don't have more than one place. People who have anxiety and depression and different mood disorders are in the same ward as someone who might be having a psychotic episode, or someone whose mental health is different and should be treated differently. Everybody's kind of just lumped into one. And when you're, as I was saying before, when you're admitted, it's often feeling like if you're not a human being, because you have to go through the whole A&E process of sitting there for hours and hours and hours. And then after you sit there for hours and you finally get up onto the ward, then sometimes if you're literally in the middle of a depressive episode or anxiety, and you're encountering a staff member that's exhausted and just has dealt with a bunch of patients all day, then their attitude towards you tends to be very rough, and you're already in a fragile state, so you have to interact, and sometimes even outside of Barbados. So I even know for healthcare systems in the US, when they're talking, you can literally just type into Google my experience in a psych ward, And a lot of people come out and they're like, I feel like if my experience was traumatizing. I got to the ward, and as soon as I got to the ward, I then felt like, oh my goodness, what have I done? Why did I put myself here? Or if you're having some sort of episode, sometimes you don't even put yourself there, but when you finally come to, it's just like, this isn't as helpful as I thought it was going to be, or as therapeutic as I thought it was going to be. And that's usually, as I said, because it's understaffed, people don't have the specific training for it, and when you don't have enough staff, they don't have the training for it, then you're kind of just on a checklist of, did I get my medication, did I eat food, did I comply with certain rules, did I have some sort of outburst, or what they would consider an outburst, because it doesn't even have to be necessarily an outburst. You could just get upset about something and then all of a sudden you're a patient that is not complying to your issue. When you don't have policies or staff or governments that are really advocating for people, the stigma is of this world. You then, like I said, get lumped in, and since people don't understand how to take care of you, by the time you leave, you can just be medicated or kind of cast to the side, or at least it feels that way. So although it says that these systems are in place for people, sometimes it doesn't really feel like if you're getting much support, because the government doesn't put as much funding towards mental health. And then you can feel like, if, okay, minimal funding is going towards it, so I either have to wait to get help that I think would actually be beneficial to me, or I have to end up in a hospital where I'm kind of not getting the help. I'm getting some help, but not the help that I actually think that I need, or you have to pay out of pocket. And we'll get into that a little bit later when it comes to financial instability. But it often feels like if you're the only person that cares about your mental health, even though you'll see politicians come out and be like, mental health matters, and even in Barbados, our president is coming out and saying that mental health matters, and it does. There's so much stigma and so much lack of care that goes towards it that it's been a struggle, a huge fight to even get that attention towards it. So let's talk about a little bit about public health crises and mental health. So after the pandemic, government's actions impact mental health barely. To me, there's a lot of negative effects. Like, the lockdown caused a lot of anxiety, loneliness, depression, because we're human beings, and human beings, we thrive on connection. We thrive on interacting with each other. So if we're thriving on this, and we've literally been put in a place where you can't interact because our physical health is at stake, then our mental health is just going to go out of whack. And there's also the negative effects of economic instability, job losses, financial struggles, added stress from that, just leading to more mental health issues. There's a lot of misinformation, because there was a lot of misinformation when the pandemic came up. But it doesn't even only apply to the pandemic. It applies to hurricanes, storms. We've had a lot of hurricanes come through, and just having misinformation, creating fear and uncertainty, worsen people's mental health. You're fearing for your life, you're fearing for your family's life, you're fearing for your environment, what it's going to do to you. Am I going to have a job at the end of this? Am I going to have a house at the end of this? Is this going to destroy everything? I can't financially rebuild everything, so how am I going to survive this? I'm already struggling. Some politicians come out with, or governments come out with programs that offer health resources like hotlines and free counseling and online support groups, but that usually is very short-lived, in my opinion, because it's for right then and right there while the crisis is happening, and then after a couple of months, when it's no longer seeming like if it's a pressing issue, people go back to not really caring about mental health, not putting it on the forefront. So why does this matter? Because the ability to access of mental health care during our everyday life or crises often depends on political decisions. That's how it's connected to political influence and decisions made. So understanding these factors can help us advocate for policies and prioritize mental health and ensure support is available when needed. Now let's talk a little bit about social equality and mental health. Political decisions about money, housing, support programs shape people's lives in a big way, and their mental health is directly affected. So with minimum wage and job security and affordable housing and social welfare. I started to talk about it a little bit earlier. When your wages are lower, or you're feeling like if you don't have a job that's secure, you feel like if you're about to lose your job, you're barely surviving already as it is. We are literally barely surviving. Before, we had one parent would be working, one parent would be staying home taking care of children, and you could survive that way. But now it's more so you can have 4 jobs in a household and you're still barely making enough to survive. So
yeah, I had to start selling papers, guys.
So when you're like overwhelmed by all of this, the stress, the depression increases because you're just worrying about, am I gonna be homeless next week? Am I gonna make it to the next payday? I don't know about you, but sometimes not even the ramen, tuna, biscuit lifestyle just be working. Sometimes it's a go to bed hungry lifestyle. That's just the hard struggle. And that was a university type thing. But now we in the working world and we still doing that. Struggles. Also, for millennials, I'm gonna say for millennials, and I'm gonna single them out because
That's out.
he just called me out and I feel attacked. But I'm gonna single millennials out because us Gen Zs,
You would like to believe.
us Gen Zs, we're not as bad as millennials. We can't afford to buy houses. We are living with our parents. And I love living with my parent because I don't have to pay bills. Well, I still gotta pay bills. But I don't have to pay all the bills by myself.
That could change after she watched this.
It could. My mother could really be like, oh, nah, it's time for you to pay all the bills. But we can't afford to buy our own houses and have our children or multiple children. At this point, I feel like most millennials are like, nah, I'm not bringing a child into this world. We can just have pets. We in the dog mom, cat mom, dog dad, cat dad era. I'm a dog mom. Yeah, my dog is my child, and he is very demanding on finances, and he's just a dog. So imagine, a child, and I can't even afford a house and struggling to pay insurance on a car. Absolutely not. So living in this unstable or poor conditions economically, or you can literally be living in unstable and poor conditions in your environment. Your house is just unlivable because you can't afford to make improvements to it. Can increase the stress and the sadness and the shame. And policies that support affordable houses can help reduce this pressure and improve mental health. But I feel like with the economic decline that's happening, that's not going to happen anytime soon, but it needs to. A lot of us are just like, I wish when I was in the womb I had stopped just floating around in fluids and I had put a down payment on a house, because right now I would have a house to live in. But unfortunately I was a baby and I wasn't making smart choices.
You know what we should do? In primary school, save all we spent the money.
Sure, but not that way. Not financially smart.
I suck on buggies every year.
But snacks was life. I don't know what y'all. Snacks was life, and all my money went to snacks.
Same, that's why you can't buy a house.
And that's why I can't buy a house, and that's fine.
Should have bought Google
It's
stock
fine.
options.
I shouldn't invest in Apple.
Yeah.
2003, what was I doing? Simone, in 2003, what were you doing?
Hey, remember, you're supposed to be a Gen Z, right? You weren't born.
Yeah, true.
I was a baby in my mother's womb in 2003. Being born in 2000 and anything, crazy. I'm sorry, guys. Y'all are babies. But, okay. Anyways, back to the topic. So, community safety and mental health and feeling safe where you live is crucial for mental well-being. There are so many blocks, so many gangs, so many violent things are happening around the world. In the US, every other day there's like a school shooting, there's some genocide, war after war after war, threats to bomb other countries, threats to Lego missiles. I have a missile button, I have a whatever button, and it's just like all of this is literally traumatizing. And it actually is traumatizing. Like, people make the joke that it's traumatizing, but it is traumatizing because living in high areas with like, not high areas, living in areas with high crime rate can also lead to trauma and chronic stress, because in these communities you're facing so many different things: the poverty, the fighting to get out of poverty, racism when it comes to America, and inequality, and feeling like I am going through a fight that I didn't even start. I'm struggling because other people started this war, you know, slavery, and now I have to get out of this fight, but also I don't have the money to get out of this fight because all the privileged people. I was gonna say something different. Guess what? Guess what I was gonna say in the comments below. Privileged people have all of this money and they're throwing their parties, getting traumatized because our communities are not safe, or at least we're feeling like if we have to, like this gang violence stuff and mental health, often it feels like if people argue over the silliest things, is like, you hate that my shirt is, I almost said a color. Let's not say colors because that's not gonna go over well. What's a color that's not gang affiliated? Yellow?
What?
There's no such thing.
Green?
Every color is gang affiliated.
I know black is affiliated, I know red is affiliated, blue
White.
is. Can we not? Like,
Yeah,
people just, it's just a color.
fluorescent peach.
Can't even say rainbow, bro.
I feel like
That's a different type of gang.
can't even say rainbow. Nothing against the LGBTQIA plus 2AS community.
I think you miss an A, but maybe not.
2AAS is AAS? It's 2A.
Oh wait.
It's something.
So 2 A's and an S. 2 A's and an S. I just said that. Anyways,
Google search.
let's move on. So, why does this matter with the minimum wage and the trauma in communities because of crime? Because politicians make decisions about wages, housing, and community safety. They shape the environment that people live in. Poor policies increase the stress, mental health problems. And then if we go back, if we're not also getting mental health, we're just going further and further into a deep dark hole of just mental instability. We're unstable. We're unstable over here. Okay, so now let's talk about the role of social media in shaping public attitudes on mental health. I don't know about you, but when I watch TV, literally all you see, bomb, shooting. Literally yesterday, okay, this is so triggering. Yesterday I saw a crushed truck and they actually showed the blood coming out of the crushed truck. They're not supposed to do that. And I was like, excuse me, so now I know that somebody died in this truck and there's blood all over the floor? Why was that necessary? also,
I mean, it could have been a strong.
It
name, so
wasn't-
it's like, okay.
it was, that person passed away. And that was so traumatizing and triggering, and I had just looked at the TV for 5 seconds. I wasn't even watching TV. Everything is bomb this, school shooting this person died. When you look at CBC Evening News, this gang member did this person is arrested for this person is wanted for this person decided that they were going to protest this. And it's just like, all right, calm down. Can we get a little bit of positivity? Whenever you research stuff, it's just like, oh, there is positivity. I feel like if they sprinkle it in at the end, or they put it on like Sundays when they don't have any other news, and it'll be like, oh, this positive thing happened in the community this week. No one watches the news on Sunday evenings. Everybody's getting ready for work and school, so no one has seen that. But there are some stories that talk about overcoming mental health challenges and highlighting important topics. But there's not enough of it. Everything is just violence, darkness, and I literally do not watch the news anymore. I don't watch TV anymore. I let people tell me about the stuff that's happening because I can't do it anymore. It's too much. I also have put blocks on certain things on Instagram, Facebook, TikTok, so that my algorithm is probably going to change now because my phone is listening to me, and it's listening to me say all of those negative words like 5 million times right now. However, usually it doesn't show me that stuff because I set it up so that it doesn't show me that stuff, because I'm tired. I'm burnt out from just listening to all of it. We're all just on high alert. There's this thing in anxiety where you are in a survival mode, and usually when you just hear back to back crises that are happening, you stay in this survival mode where you just get jumped easily, or you're like on edge, and you just feel more exhausted more often, because it's like if we're all living with PTSD because we're waiting for the other shoe to drop, or we're literally just like, oh my goodness, this happened today, that happened yesterday, can we stop now? No, we can't stop. No. And it's just too much. The newspapers, they all have control of how all of that is delivered, and I feel like sometimes they could deliver it a little bit better. But how is that influenced by political views, like political influences the decisions and stuff? It's usually because the media only covers mental health crises whenever they want to drive a certain narrative, a certain policy that they're trying to get through. But it's not like constant, and it's not a widespread concern. It's only beneficial when it's beneficial to somebody, and not because mental health is an important topic. And I think that's seriously flawed. Mental health is important regardless of which politician, which government says that it's important or not. We're all struggling, and it's something that's universal. So why is there not more information about it? Why are we not talking about it more? The influence of laws on mental health narratives. So mental health in schools. We do not talk about mental health in schools enough. I remember for secondary school, which was like 2 years ago.
Don't joke.
I can't even say that with a straight face. I remember in secondary school, my guidance counselor never used to come to my class for guidance. I didn't learn anything in guidance, and guidance is when you're supposed to be talking about mental health. I don't know if it's changed now, if like also used to just like sometimes allocate guidance counseling to a random teacher that was already teaching another subject. So they're focused on the subject that they're teaching, and then they're supposed to be the guidance counselor. And it's just like, how about we actually have guidance counselors that are there to counsel people and give them guidance. Snaps. How about we employ psychologists to be those guidance counselors, and not just people who are teaching other subjects and are not qualified enough to be doing that. So we really need to help the children cope with stress and seek help early. So personally, I feel like if we really need to target children at a young age, that sounds like bad, but I mean it in a very positive way. Look at children who are growing up and no learning certain terms, but usually they learn it from TikTok. They learn about sexual identity in general, body image, bullying, peer pressure. They learn about all of these topics from each other or misinformation, and it's just like, if we were being proactive instead of trying to meet them when they're already violent, when they're already dropping out of school, when they're already not focused on a career anymore, if we meet them before they get to that point, they literally grow up thinking, okay, this is important, this is not shameful, there's no stigma around this, I can talk about this, I can come to my parent and adult about this and actually deal with the problems before they get to the point where you're in a mental health crisis. I feel like it also applies to workplaces. Like, there are not enough policies for people to feel like, if, okay, I have mental health days that I can take, or I can go to my employer about this, I can get therapy through my workplace because I'm triggered about XYZ that's happening. I feel like if I'm having this issue, if we're all struggling with living and job instability, wage issues, stress. If you're liking this episode, please like, subscribe, press the bell notification, share, and comment. So, what does that matter? The media and government policies shape how we think about mental health and whether we feel safe enough addressing it. So with the schools and work and on national TV, newspapers, online platforms, all of that is affected by how the government policies stigmatize mental health, or say, okay, mental health is good and we should advocate for more mental health policies, we should talk about things more, we should not have as much negative portrayals of mental health or mental illness, I should say, so that we make people feel less isolated, less ashamed, and understand that talking is important. So our final topic is advocacy, solutions, and moving forward. Just kind of like a little wrap up of what I've been talking about this entire time. So when we advocate for mental health within politics, it's crucial that it ensures mental health is taken seriously. This entire time we've been talking about how they've been falling short and how we really need to support more policies where mental health is at the forefront, and we're saying, okay, it's important to talk about mental health. So advocacy matters because politicians decide how much funding, as we said, with the hospitals, with the healthcare systems. They are the ones that really say, okay, we're going to put all the money towards physical health care, or mental health care in various healthcare systems, and what programs are available to people. So how easy it is for people to get help. How we were talking about in the UK and Canada, like NIS, how even though it's free healthcare, you have to wait in long lines, or you have to wait a long time to be able to get access to mental health services. You don't have enough doctors psychiatrists, psychologists giving mental health care necessary. So advocacy puts pressure on the governments to make mental health more of a priority, and it causes them to say, okay, we're going to increase funding for mental health, so we're going to allocate money to more counseling, to more therapy, crisis hotlines. Like, even our hotline here in Barbados is down, and it's been down for so long, and that's not good, because what about the people who are struggling with depression or really want to harm themselves? What about children who just want to talk about bullying or peer pressure or struggles that they're going through? So we really need to get funding towards these things, so that we have people that are paid to go and work these hotlines, to be a part of these various systems, so that mental health is more important. The education of children, even adults, need to be educated more on mental health and how to recognize and address mental health challenges. Workplace support, creating laws that require employers to offer mental health days, counseling programs, and trainings. I feel like if with training, like I was saying, even for hospital workers who are supposed to be working with people who have mental health issues, there's not enough sensitivity training. They're dealing with these issues and just talking to people any old regular way, and it's just like, I'm a human being, and even though I'm going through something and you might not be going through that thing, or you might not understand it, I still need you to treat me like a human being. Mental health issues, challenges doesn't mean that I'm less of a person. So
Question. What about those in the healthcare industry that
they're not even getting enough healthcare, mental health
I mean
services.
that they want to help, but I think it's hard to help when someone with a mental health problem throws poop at them. After someone throws a handful
That's with the
of
training.
feces,
That's what the training on
Very
how
difficult.
to help that person. And not all mental health struggles are that. There are mental health struggles that are more common and everyday. Like, I don't want to just make anxiety, depression, mood disorders, and those types of issues seem so like generic and everybody has them. But stress, burnout, topics like that are lumped in with people who are having psychotic episodes and psychosis, and it shouldn't be that way. So you can't treat somebody who is having a non-psychotic episode but a mental health issue nonetheless that is just as serious, the same way that you would treat somebody who's throwing poop at you. If we have more staff and more people focused on the different areas, and you had more training for those people of, okay, how do I handle poop being thrown at me? Do I even have my own support? Because a lot of therapists have to have therapy sessions of their own. Why are these healthcare workers not having therapy sessions of their own to deal with the people that they're dealing with? They're, as I said multiple times, overworked. So I can't even put all the blame on them. As you said, if somebody's throwing poop at me, I don't want to deal with the person in bed 3 that's crying. Like, stop it. Quit it. What are you crying for? I just got poop thrown at me. I've been on my feet for 20 hours and I can't handle it anymore. Like, it's all understandable, but at the same time, it's like there needs to be more people. And we also need to be trained on how to deal with those things differently if there's more education on it. So if you go through a nursing program or a doctor's program, yes, you do have interactions with people who go through mental health issues, but you're not specialized as somebody that's like a psychologist or a psychiatrist who has the training to deal with those people. And if you don't have all of that training and you're the person that's there most often, because that's the truth, the nurses are there way more than the psychiatrists, way more than the psychologists. They're the ones that are with the patients constantly. So if they're with the patients constantly, they need to have as much or close to as much knowledge, and not just nursing knowledge, but the training on how to handle, so the sensitivity training on how to handle these issues and how they themselves can treat their mental health so that they can deal with these issues and not treat everybody the same. So that kind of wraps up our session for today.
Already?
Yeah. A lot of thoughts were brought up. Staying informed, talking about mental health, some criticisms. Even though at the beginning I said I didn't really want to give my opinion, I didn't really give a lot of opinions there. Like, I feel like I got into it a little bit, but and that actually makes me nervous to share my opinions about things. Let's be a little bit raw for a second here, but when mental health comes into play, it's just like, no, we need more advocacy. We need more policies. And although there are some things and people are trying, I feel like people could try harder.
Yeah, I think the stuff toy behind this somehow.
He's just as upset as I am about this topic.
Oh, gotcha.
He didn't want to make this podcast episode either.
Right.
He didn't want to be upset by these issues that we have to deal with mental health and political influence on mental health. So he's upset.
Fair enough.
Anyways, any more comments from the gallery? No.
My name is Dave.
Okay. So,
What are your political views about
thank you so much for watching today's episode. If you liked this episode, please like, comment, share, subscribe, turn on your bell notification so that you can be notified whenever we have a new episode, which is every Monday. And thanks so much for watching. See you next week. Bye.